Hello, I am Dr. Sarah Roos. I'm an Equine Technical Manager for Boehringer Ingelheim, and today we are going to talk about Equine Protozoal Myeloencephalitis, EPM. EPM, like I just said, is Equine Protozoal Myeloencephalitis. So if we break that down, equine, so it affects horses. Protozoal, which is an infectious organism, so it is essentially a parasite that invades the nervous system of horses. So myeloencephalitis means that it goes to the brain and the spinal cord of horses and causes neurologic disease. There are two different organisms that can cause EPM. The one that we know the most about gains entry into horses if they eat possum feces. The clinical signs of EPM can be incredibly variable from horse to horse. In some cases, it's very subtle, so it's a horse that has just a gait abnormality, maybe stumbling, maybe tripping. Often will have asymmetry, so one side of the horse will look very different than the other, both in terms of how they're moving, but also they may lose muscle just in one vocal area of their body. Often they're leaning, they may be falling. In some cases, they're truly laying down and can't actually stand up. They might have a head tilt. They may appear blind. They may have trouble swallowing. So again, a really wide range of clinical signs that can be seen with EPM. So diagnosis of EPM is always going to start with a neurologic exam. What we're looking for when we do a neuro exam is to assess some basic reflexes in terms of how the horse responds to things, as well as asking them to walk and move in certain ways that help us to figure out if they know where their feet are, which is an indication of whether or not they have neurologic disease. If we say yes, this horse does appear to have some neurologic issues, we might next do a blood test. The problem with the blood tests for EPM is that it only tells us that your horse has been exposed to the disease, not necessarily that the disease has actually infected the nervous system. So at this point, the only way for us to truly diagnose EPM is to collect spinal fluid from your horse. And that tells us again that the disease has actually made it into the nervous system of the horse and is causing those clinical signs. Not every veterinarian is comfortable collecting spinal fluid in the field. So in some cases that might mean that they're going to suggest that you take your horse to a university or a referral hospital to have that procedure done. So the outcome for horses with EPM will depend a little bit on how quickly it was recognized and treated. Somewhat generally across the board, we say that a horse diagnosed with EPM that is treated, a third of them will go back to normal. So we'll go back to their previous level of athleticism and whatever their job was prior to diagnosis. A third of horses will get better, but maybe still have some degree of deficits or issues. And a third of horses, may not respond to a level that makes it safe or comfortable for them to continue on. So if as a horse owner you suspect that your horse might have EPM because you've noticed it doing some abnormal things, really your first step should just be to call your veterinarian. The faster that we can see your horse, recognize a problem, and diagnose and start treatment for EPM, the better the outcome will be. I am Dr. Sarah Roos, and working with your veterinarian, we can master equine health.